Hi everyone. Hello. Hi everyone. Hello. Hi everyone. Hello. Am I audible? Hi, black and white. Am I audible? Right? Yes. Thank you so much. So hi Abu Bakr. Hi AA. Right. This is going to be a session on the NEET PG 2023 recall of all the questions I could find on pharmacology. And now I know the exams khatam ho gaye hain, so it's the time now you can relax. Do not stress too much कि क्या हो गया कैसा हो गया. So just relax and see what all questions are there being there, and you can don't get into the dissection mode. Do not do that. So what I would like you to do is I would like to tell you all the questions जितने मेरे को possible है. We have been able to make the questions as far as possible which were according to the exams. In case there is anything which is incorrect or anything missing, kindly let me know. We can add on to the question or the options so that it helps everybody, because we also want to make the correct stem rather than the answer also. ठीक है? So now, before first things first, if you want to get your rank, predicted, so what you do is you will click on the link. There will be a link in the description box later on the rank predictor, and you can enter your NEET PG, approximate score of your NEET PG you can enter, and then you can get your estimated score accordingly. So it will just help you predict your rank, so you can do that, right? So it's just an estimate of how you can do that, right? Yes, Govind, yes, it is Kashmiri, yes. So the second announcement is that the An Academy, they've started the batch for the next upcoming session or the upcoming exams, and it's going to start from 28th of March, and the duration is 9 months. It's going to be a very power packed and all full educators who are experienced with their question banks and integrated approach. So you can avail this at the rate of 21,580. It's going to really boost up your career, the scores in the exams, upcoming exams. Okay, so make sure that you subscribe to these. Now let's start with the recalls. So again, anything which you find wasn't there in the paper actually, or आपको लगता है कि उसके जो options थे they were not there. So make sure you let me know so that I can correct it here and then. Okay. So let's start. The first question. The farmer with OP poisoning was treated with IV atropine and pralidoxime. After that, he presents with hypothermia. What could be the reason for the present complaint? So this was the question, and the options were: first, OPC poisoning, side effects of pralidoxime, side effects of atropine, or aspiration pneumonia. So let me know क्या mark किया है? What is the correct option? What have you marked as the correct option for this? So what was the answer to this? Yes? It's a fairly easy question. काफी बारी पूछा गया है पहले भी in one form or the other. So it's a fairly easy question. So the correct option is 2. Side effects of pralidoxime. Okay. Pralidoxime. Okay. See here you make note of this thing. उन्होंने specify किया है hyperthermia. ठीक है? So अगर specify किया है hyperthermia, we have to lay stress on hyperthermia. Or which drug causes hyperthermia here? Remember atropine. ठीक है? So the correct option is side effects of atropine. You remember side effects of atropine? Let me just let you see the side effects of atropine. कौन कौन से होते हैं? Dry mouth, blurry vision, mydriasis जिसको हम कहते हैं. So photophobia can be there. Urinary retention, constipation, hyperthermia. Now this hyperthermia, why is there hyperthermia? Because there is decrease in the sweating. So decrease in the sweating. Thick pen and highlighters. All right, I will use thick pen. Okay. Let me see if this one works. This much is okay? Is this thick okay? P. Or should I put? Okay. Let me tell you what is the... See, hyperthermia आपको mark करना है. I'll use in the correct option is, here you can use side effects of atropine. ठीक है? Side effects of atropine is the correct answer. And why? Because there is decrease in the sweating. Decrease in sweating जब भी होती है, that will increase the body temperature. More thick. All right, more thick. Let's do this one. Okay. This much. Let me know if this much is visible. Okay. So hyperthermia, that you should know that hyperthermia का reason है because of decrease in the sweating. So decrease in the sweating, that is the main cause of hyperthermia here. So the correct option is side effect of atropine. Welcome P. और इसीलिए हम इसको बच्चों में it is contra atropine fever, ठीक है? It is contraindicated because of this reason, hyperthermia. So the correct option is hyperthermia. Let's go to the second. I hope, or again I'm saying any discrepancy आपको लगे options में, just let me know in the chat. Okay? Alright, next question is, child while playing consumed a fruit from a tree and was brought to the hospital with complaints of restlessness, painful swallowing, photophobia, not able to pass urine with dry, hot skin. Identify the poison and its antidote. Again, see, similar cheese. Dry, hot skin, photophobia, not able to pass urine. Not able to pass urine. Remember this. So, इसमें अब आपने क्या आंसर मार्क किया? इसमें क्या मान सके? You have to see, यहाँ पे आप देखो ये 3-4 चीजें बहुत जरूरी हैं to know. So what have you marked in this? B. Datura physostigmine. 2. Excellent, excellent. Yes. This is the correct option. So again, atropine. So आपने ये देखना है कि whether आपको question आता है या belladonna पे, datura, atropine poisoning. All three mean the same, right? चाहे belladonna poisoning है, datura poisoning है, atropine poisoning है, question किसी पे भी हो, your option remains the same. That is your physostigmine. So physostigmine is the drug which is used for the management of atropine poisoning. And why not? Yes, it was very easy. Why not neostigmine? Because it does not cross the blood-brain barrier. So this was a simple answer. So 2 questions were asked on the atropine poisoning. So remember, atropine poisoning, antidotes poisoning, they're very, very important. कोई ना कोई question हमेशा आता है. So always focus quite a lot on these poisonings and their antidotes. What are the features? What is the treatment? And that is important. Right? So let's go to the third one. Now, third question. Which one of the following drug inhibits both neprilysin and ACE. दोनों के दोनों inhibit करते हैं. Both. Yes. Which one of the following drug inhibits both neprilysin and ACE? Yes. What should be the correct answer? Yes, come on. 3. 3 means losartan? No. No, not losartan. Losartan is a... What is losartan? C. No. This question was tough? Alright. Okay. Then I will tell you क्या इसका आंसर है. The answer is the last one. Omapatrilat. Please, this is another important. इसमें से सारी drugs important है. I will tell you one each की क्या क्या इसमें ज़रूरी है. Yes, losartan is the angiotensin receptor blocker. So it doesn't block the neprilysin also. Let's go. I'll briefly tell you क्या क्या important है इसमें. जो nesiritide है, that is a BNP analog only. Brain natriuretic peptide analog only, and it is a potent vasodilator. So nesiritide option में से कट गया. ठीक है. Coming to the second one, which is sacubitril. जो sacubitril है, it is a oral neprilysin inhibitor. ठीक है. So oral neprilysin inhibitor है, but it is not an ACE inhibitor. तो फिर ये भी कट गया. So जो oral neprilysin inhibitor, और आपको इसमें एक और चीज याद करनी, which can be asked in the upcoming exam, is about this ARNI, angiotensin receptor blocker and neprilysin inhibitor. ये जो combination है sacubitril और valsartan का, it is approved now for advanced CHF. So it is quite a expected question आ सकता है आगे. Yeah. So it is ACE inhibitor, right? 81 से 82 ACE inhibitor ही block करता है. Okay. So the question is ACE inhibitor. So here we can write, you are saying ACE की जगह था, it inhibits ACE 1 to ACE 2. That can be replaced here. Right. I think it became a little too much. Okay. ठीक है? Got it. Got it, Vivek. Thank you. So this one again I'm telling you sacubitril and valsartan for future, but इसमें answer ये नहीं है because it is only the neprilysin. Losartan you all know it's a angiotensin receptor blocker. रह गया last में omapatrilat and sampatrilat. So this is the answer to this question. ठीक है. Omapatrilat, yes, physostigmine crosses blood-brain barrier. It's a tertiary compound. So omapatrilat ही आंसर है, and sampatrilat another drug, and they actually are not used. Please remember ये use नहीं करते हैं, इसको हम use नहीं करते हैं. The reason is because ये definitely they are inhibiting the ACE end, but the major problem is angioedema. So इतना angioedema हो गया लोगों को कि इसको हमने आगे continue ही नहीं किया. All right, please, sure. So इतना इसमें angioedema हो गया, it wasn't even continued. So though it is not a drug which is used, but because of its mechanism. Clear नहीं दिख रहा question? Is it a problem with everybody? Is there a problem that it is not clear? Kindly let me know, because my end से तो clear है, in case there is an issue. Okay. ठीक है. So inhibits the ACE and NEP. That is the answer is, it's clear. Thank you. Omapatrilat, sampatrilat. ठीक है. यही answer है. Please remember this in case it is repeated in the future. ये चारों के चारों drugs important. Like nesiritide is important as a BNP analog, can be asked in exam as a mechanism. Sacubitril very important, especially the ARNI is very important. Omapatrilat, sampatrilat, they have asked though it is not in use. I don't know the reason, but still इसका आंसर यही है because ये दोनों inhibit करती है ACE और NEP को. अगर next exam में आता है what was the major issue with this, तो आपने लिखना है angioedema. Mark angioedema as the major problem with these group of drugs. That's why it is not used. Right? Okay. Let's go on to the next question now. All right, clear. Which of the following drugs shows the side effects of pulmonary fibrosis and hypothyroidism? I hope this was the clear question. Which of the following drugs shows the side effect of pulmonary fibrosis and hypothyroidism? This was the question. Yes, very good. Yes, P. Excellent. The answer is amiodarone. Question ठीक था. This was a question and the options में कोई problem, कोई और options तो नहीं थे. This was about I could gather. Yes, it is amiodarone. Definitely it is amiodarone. All of you are almost giving the correct answer. Excellent, Gurja. Very good. AA. P. Yes, it is amiodarone. ठीक है? Yes, I have prepared this for you. So remember this. All the drugs causing pulmonary fibrosis. You want me to write or is it? So remember a mnemonic for this. BBC ban me. ठीक है, remember BBC ban me. यही drugs हैं. So B is for bleomycin, another B is for busulfan, then cyclophosphamide, bromocriptine, amiodarone, nitrofurantoin, methotrexate. ठीक है, very important. Can be asked again. कोई और drug डाल देंगे इनमें से. So remember, make a note of these drugs causing pulmonary fibrosis. And the second thing which is important here is to know about the side effects of amiodarone. It is a very important drug because of its side effect. All right. ठीक है. So, okay, P. Thank you. I will do that next time. ठीक है. So, amiodarone के और जो side effects आपको आने चाहिए, corneal micro deposits. ठीक है जी. corneal micro deposits भी इसका एक side effect जो है पूछ सकते हैं. ठीक है. So, liver toxicity पूछ सकते हैं. myocardial depression. Myocardial depression. I think the thickness of the pen के वजह से it's becoming a little thing. ठीक है. Yes. So you can, yeah, they call us, yes, usually it is asked corneal micro deposits. So you can write that. ठीक है. So amiodarone side effects are very, then hypothyroidism. The reason for hypothyroidism because it interferes with the peripheral conversion of T4 to T3. इसका ये one of the reason why it causes hypothyroidism. All right. ठीक है. You can do this, right? So ये pulmonary fibrosis very, very important and amiodarone again very, very important. All right. Next. Let's come to the next question. Now, digoxin plasma concentration is 4 nanogram per ml and the doctor wants it to reach the therapeutic plasma concentration of 1 nanogram per ml. How much time will it take considering the half-life of digoxin is 40 hours? ठीक है? Half-life is 40 hours. Half-life of digoxin actually 40 hours. So, क्या important चीजें हमने हैं? Currently, the plasma concentration is 4 nanograms per ml. But what we want is 1 nanogram per ml. और जो third thing दिया half-life of digoxin is 40 hours. Now, tell me the answer to this. 80. Very good. 80 hours. Excellent. So the correct option is 80 hours. Now why 80 hours? It is a very simple question. उन्होंने यही पूछा है कि originally तो ये 4 nanograms per ml था. Ultimately हमें क्या चाहिए? 1 nanogram per ml. ठीक है? So और 40 hours दिया इसका हाफ लाइफ. एंड यू नो द हाफ लाइफ, जो फर्स्ट हाफ लाइफ क्या होएगी? फर्स्ट प्लाज्मा कॉन्सेंट्रेशन टू कम हाफ ऑफ ओरिजिनल कॉन्सेंट्रेशन. तो पहले होएगा ये 2 नैनोग्राम पर ml. इट्स ओके, डोंट वरी. उसके बाद 1 नैनोग्राम पर ml. ठीक है. सो फर्स्ट कितना इसको यहाँ पे टाइम लगेगा? फॉर दिस इट विल बी 40 hours. Again, to go half, it will be 40 hours. तो 40 plus 40 कितना हो गया? 80 hours. So the correct answer is 80 hours. This was actually the whole exercise. सिर्फ आपको half life को add करना था. And you know that the digoxin plasma concentration, it should, whenever 4 nanogram per ml is a toxic concentration for digoxin. So that's why he wanted it back to 1. Otherwise the patient को arrhythmias and all these problems शुरू हो जाती हैं. So this is the correct option to this. And again, digoxin is a very, very important topic. इसके बारे में सब कुछ पढ़ना चाहिए, इसके correct therapeutic levels and उसके, yes, sometimes what happens is when the question, yes, so यही होता है जब बड़ा हमें लगता है कि इतना easy question आ कैसे गया, ठीक है, इसमें तो ज़रूर कुछ झोल होएगा, ये कुछ बता रहा है, ये कुछ बता रहा है, but sometimes इतना easy basics होते हैं. So that is usually what happens. Yeah, I can understand. तो डिजॉक्सिन, आई वाज सेइंग, इट इज़ वेरी इंपॉर्टेंट. उसकी हर एक चीज़ हमें आनी चाहिए. डिजॉक्सिन एज अ ड्रग, उसकी पॉइजनिंग, उसकी एंटीडोट, ये सब कुछ हमें आना चाहिए, राइट? ऑल राइट. नाउ कमिंग टू द नेक्स्ट क्वेश्चन इज रिगार्डिंग द ARBs. P will, the team will let you know accordingly, right? We will definitely let you know. So regarding the ARBs, which is the true statement? Now this was मतलब थोड़ा सा उन्होंने इस क्वेश्चन को लिटिल ट्रिकी कर दिया, ठीक है. Now the first option is losartan has thromboxane A2 antagonist action and attenuates the platelet aggregation. Number 2, tell me sartan clearance is affected in renal insufficiency and not in hepatic. Irbesartan clearance is affected in both hepatic and renal insufficiency. And last is candesartan clearance is affected in hepatic insufficiency and not in renal. So yes, please. Okay, Dr. Ashutosh says A, P says 2, Gurjar Deva says A. Have you seen in this question, last तीनों options, second, third, fourth similar है, सिर्फ एक को उन्होंने बिल्कुल अलग कर दिया. Maybe they're giving you a hint कि this is the correct answer. है ना? अदरवाइज लुसार्टन में कुछ नहीं दिया. दे कुड हैव गिवन कि उसकी भी रीनल इनसफिशिएंसी दे सकते थे, बट दे हैव नॉट गिवन एनीथिंग. दे हैव जस्ट कंप्लीटली चेंज द फर्स्ट ऑप्शन एंड द रेस्ट 3 आर ऑलमोस्ट सिमिलर. एनीवेज, यस, द करेक्ट ऑप्शन इज 1. ठीक है, इट इज 1 डेफिनेटली. एंड नाउ आई विल टेल यू, एक ये मैं अभी स्लाइड दिखाऊंगी आपको एंड about the renal and the hepatic clearance, जो आपको इसे पता होना चाहिए. So this is actually given in Goodman Gilman में दिया था. I've seen that they mentioned all these things. So ये सारा points important है. Remember, candesartan is that drug which is unsafe in both liver and kidney disease. ठीक है, candesartan दोनों में unsafe है. इर्बीसार्टन इज अनसेफ. बाकी सारी की सारी याद करने की जरूरत नहीं, सिर्फ कैंडीसार्टन याद कर लो. अनसेफ इन बोथ लिवर एंड किडनी डिजीज. बाकी आप जितनों भी देखोगे दे आर ऑल अनसेफ इन लिवर डिजीज. ठीक है. टेल मी इज अफेक्टेड इन लिवर. द ऑप्शन वाज टेल मी इज अफेक्टेड इन लिवर. वाज दिस द ऑप्शन? Because I got to know this one is the option. Because tell me is actually unsafe in liver disease. तो अगर affected, because अगर affected है फिर तो ये option होना चाहिए था. Then let me confirm, because this was what actually I got, affected in renal insufficiency and not in hepatic. Can anybody clear that? What? No, Dr. Ashutosh. No is to what? Second option. Is whatever option जो मैंने लिखा, is that correct or was it the other way around? Let me know in the later in the chat, in the comments, then इसको फिर, because that will change. Options are correct, all right, because otherwise it will change the answer. ठीक है, because first तो definitely correct है, उसमें कोई doubt नहीं है. तो वो वो नहीं हो सकता कि अगर ऐसा हो फिर तो फिर controversy हो जाएगी इसमें. ठीक है, सो मे बी पी. आई थिंक मे बी यू गट, बिकॉज ये सारा है ना, कौन हेपैटिक में है कौन, सो मे बी यू गॉट अ लिटिल कंफ्यूज्ड इन दैट. ठीक है, सो लोसार्टन आंसर इज एब्सोल्युटली करेक्ट. और ये चीज़ें आई हैव सेड, मार्क, जस्ट इसको याद कर लो फॉर फ्यूचर. कि एर्बीसाटिन, टेलमीसाटिन, लोसाटिन ये तीनों के तीनों अनसेफ है लिवर डिजीज में, कैंडीसाटिन दोनों में ही अनसेफ है। ओके गुरजू, थैंक यू। नेक्स्ट क्वेश्चन प्लीज। नाउ दिस वाज अनदर क्वेश्चन। एक सेकेंड। The ECG changes of tall T waves occurred while the patient was on an antihypertensive drug who developed chest pain. Which drug can cause this? Yes. So this is not the exact graph or ECG you would have got. I've just taken from somewhere to show you the tall T waves. These are the tall T waves. ठीक है, ये tall T waves होते हैं। तो हाँ जी, correct option here. Correct options. Yes, one you've given spironolactone. Excellent, excellent choice. Yes, this is the correct option. Because जो tall T waves हैं, they are classically seen in condition called as hyperkalemia. ठीक है, hyperkalemia. तो spironolactone is the drug which causes hyperkalemia. You know, it's a potassium sparing diuretic and it causes hyperkalemia. बाकी कोई भी ड्रग नहीं करती है hyperkalemia. ठीक है, right? All options are correct here and everything clear? All right, all right. और एक चीज अगर हम hyperkalemia के बारे में एक और चीज I will tell you that remember this, जो कि सारे जो RAS drugs हैं, renin inhibitor, aldosterone inhibitor, ACE inhibitor, spironolactone, they will all cause. So सारा RAS hyperkalemia cause करता है, ठीक है? So सारा RAS hyperkalemia cause करता है, सारा RAS. This is one thing that you should know. All right, let's coming to the question number 8. Drug used in dialysis disequilibrium syndrome is? Yes, dialysis disequilibrium syndrome is. हाँ जी, ऑप्शन प्लीज। यस, करेक्ट। क्या ऑप्शन आपने मार्क किया? 3। डॉक्टर आशुतोष says 3. वेरी गुड, दिस इज द करेक्ट ऑप्शन। मैनिटॉल। मैनिटॉल इज द ड्रग which is used in dialysis disequilibrium, because इसमें क्या होता है जब dialysis disequilibrium syndrome होता है, it raises, there's an increase in the intracranial tension and there is cerebral edema and the drug of choice here is mannitol. So जो आपको mannitol के uses हैं आप ये देख लो, CAD. It is okay, dialysis disequilibrium दे दिया ना उन्होंने, ठीक है? So जहाँ पे dialysis, तो it is mentioned जो dialysis disequilibrium का जो treatment है, it is this. So I will write along with this there was hypokalemia. All right, thank you. Hypokalemia भी था, I will write along with this. ठीक है? So बस ये आप इसके uses you remember. Acute congestive glaucoma, cerebral edema, IV mannitol drug of choice है यहाँ पे, ठीक है? So we all have to know this. उसके बाद आ गया डायलिसिस डिसइक्विलिब्रियम में हम इसको यूज करते हैं, नो अदर डाययूरेटिक, ओनली दिस। उसके बाद आ गया आपका सिस्प्लैटिन इंड्यूस्ड नेफ्रोटॉक्सिसिटी। दे आर बेसिकली टॉकिंग अबाउट द डिसइक्विलिब्रियम हियर बिकॉज सेरेब्रल एडीमा इज समथिंग वी नीड टू क्लियर फास्ट। तो पहले हमने उसको स्ट्रेस करना है, फॉर दैट इट इज योर मैनिटॉल हियर, ठीक है? सो हमने सेरेब्रल एडीमा को पहले टारगेट करना है बिकॉज जैसे आप हीमोडायलिसिस करते हैं एकदम से ये प्रॉब्लम आ जाती है एंड दैट कैन बी life threatening to the patient, the cerebral edema. So first you have to clear that and for that first and foremost we use mannitol. उसके बाद में बाकी चीजें देखेंगे. And okay, continuing with the uses, remember CAD. C is for 2, cisplatin induced nephrotoxicity and cerebral edema. A is for acute congestive glaucoma, D is for dialysis disequilibrium. Remember these uses because कई बारी repeat questions आने के chances होते हैं later on. तो अगर mannitol कोई और reason दे दिया, cisplatin दे दिया, कुछ दे दिया, so remember these are the uses of mannitol. And जितने important uses हैं उतने important contraindications भी हैं. Absolutely contraindicated in pulmonary edema, cerebral hemorrhage, acute renal failure. We never use mannitol in these conditions. ठीक है? So तीनों चीजें, pulmonary edema, cerebral hemorrhage, acute renal failure, they are the contraindications. और जो इसके uses हैं, the drug of choice है, ठीक है? So for the cerebral edema and acute congestive glaucoma, right? Okay. Now this was a very easy question. I think इसमें the next one, which is the mechanism of action of TPA, tissue plasminogen activator, is. I think ये बहुत simple question है. Yes. Three, yes. Fourth option, I have no idea. Anybody knows the fourth option? You're right, P. It is the third. It is fibrinolysis. Very simple. Anybody knows what was the fourth option? I just have three options with me. Fourth options I didn't know. So because we can complete the question if we get the fourth option here. No idea? Inhibits intrinsic. Okay, thank you. Inhibits the intrinsic pathway. All right. So I hope there's no doubt in this question. This is fibrinolysis. It inhibits the conversion of, wait, I just need to decrease this size. So it inhibits the conversion of, yes, you know, plasminogen to plasmin, and that will inhibit the, or that will cause the fibrinolysis. So ये एक simple question है, ठीक है? इसमें ज़्यादा कोई complication नहीं है. Very straightforward question. Going to the next one. Yes. An asthmatic patient using nebulizer developed oral thrush on buccal mucosa and tongue. Fourth, I think P has given intrinsic pathway. I guess we can put that. If somebody remembers, you can put it in the comment section. We'll check it later. फिर उसको add कर सकते हैं उसमें. ठीक है? चलो, an asthmatic patient using nebulizer को oral thrush हो गया. Which antifungal will you use? Oh, black and white says 5. Okay. 5 is not the correct, sorry, flucytosine 4, sorry. No, वो तो नहीं है correct option. और कोई? कौन सा यूज कर सकते हैं? 3. Abhishek says 3. Excellent, Abhishek. Yes, Vikas, very good. It is clotrimazole. Clotrimazole ही यूज करेंगे. Yes, Deepika. Great. So this is the correct option. ठीक है? Yes, Ankur. Excellent. So क्या है? जो टर्बिनाफिन है और जो ग्रीजियोफल्विन है, उनके यूजेस सिर्फ डर्मेटोफाइट्स में है. ठीक है? और जो 5-flucytosine है, अकेला तो it is not used much, but along with amphotericin B, it is used for cryptococcal meningitis. Please remember this, cryptococcal meningitis. दोबारा आ सकता है. Which drug? Options for cryptococcal meningitis. और जो टर्बिनाफिन है, dermatophytes, griseofulmin, tina capitis. So only either clotrimazole is the correct option here, not the rest. ठीक है? Topical है, lozenges भी मिलते हैं. ठीक है? So you remember that. ठीक है? All right. Let's go to question number 11. 11 में हम आते हैं patient not responding to haloperidol and thyroidazine. So a new drug was added. After adding the drug, the patient complained of excess salivation, hyperlipidemia, weight gain, hyperglycemia, and sedation. So what is this new drug? Black and white says 2, clozapine. Very good. So हम पहले important चीज़ें इसमें highlight करें. पहले patient नहीं respond कर रहा था to haloperidol and thyroidazine. So that means it was resistant. ठीक है? So it's a resistance. Oh yeah, I just forgot. दोबारा याद आ गया. Thank you. So it is not responding to haloperidol and thyroidazine. ठीक है? So resistant है. A new drug added. अब drug जब add कर दी हमने, उसके बाद क्या हुआ? उसके बाद salivation, hyperlipidemia, weight gain, hyperglycemia and sedation. ठीक है? Oh, right. Stitch in time says 9. ठीक है? So very good, Ankur. You've changed the option. Yes, it is clozapine. So the correct option is clozapine. Now, इसमें हम क्यों clozapine करेंगे? सी, जो बाकी जितनी भी एटिपिकल ड्रग्स होती हैं उसमें देयर कैन बी लिटिल बिट ऑफ हाइपरलिपिडेमिया एंड यू नो ये सारा मेटाबॉलिक सिंड्रोम ही है बेसिकली जिसको हम कहते हैं. इट इज अ मेटाबॉलिक सिंड्रोम. वेरी गुड. वेट पिलो, ये मेटाबॉलिक प्लस जो डिफरेंशिएटिंग फीचर एक्चुअली यहाँ पे है, दिस इज योर एक्सेस सलाइवेशन ऑफ सियालोरिया. Yes, as P rightly says, yes, weight gain is also there. Yes, that is there. Sedation is there. But ये जो है ये क्लासिकल चीज है जो क्लोजापिन में दिखी गई है. ठीक है, सो एक्सेस सलाइवेशन ऑफ सियालोरिया विच इज वेट पिलो. और क्या चीज होती है क्लोजापिन में विच इज वेरी इंपॉर्टेंट टू रिमेंबर द एडीआर्स में? एनीथिंग एल्स विच इज वेरी इंपॉर्टेंट फॉर क्लोजापिन एडवर्स इफेक्ट्स टू रिमेंबर? या वेरी गुड, इट इज पैराडॉक्सिकल हाइपरसलाइवेशन. और क्या चीज है? एनीथिंग एल्स? Yes, zap करके weight gain clozapine ma'am. Yes, excellent Mandar. It is agranulocytosis. Yes, that is also another thing that you should remember. Cytosis. ठीक है? Very good. See, actually ये है कि करना नहीं चाहिए था because it acts on the कौन से receptors पे act करता है? Clozapine. It should be decreasing rather than increasing. That's why it is called as paradoxical effect. Okay, coming to the next question. Yes, alcoholic patient develops nystagmus, confusion, ataxia और ये alcoholic है. So alcoholic में जब भी ये problem आई और vitamin deficiency आई, yes, we should always think of vitamin deficiency and which vernix encephalopathy, thiamine. Excellent, all of you have marked it correct. It is vitamin B1. I think a lot of questions have been asked these days about vitamins, so please vitamins के बारे में try to remember more and more and revise vitamins very well because काफ़ी questions आ रहे हैं vitamins के बारे में. It is vitamin B1, thiamine deficiency. Yes. Okay. So again, this one, another very important topic and ये बहुत बार किया जाता है. Aspirin is very important, very, very important. Given first, thiamine or glucose? Here, 100 tablets of aspirin. ठीक है, what should be the treatment? Sodium bicarbonate. Rameshwar says sodium bicarbonate. Vikas, are you answering for this? Sodium bicarbonate, okay. Sodium bicarbonate. N-acetylcysteine, no, beta. Yeah, I know. So vitamins are very, very in these days in the exams. N-acetylcysteine, no. N-acetylcysteine is for paracetamol toxicity, not aspirin. Ammonium chloride is for toxicity when it is with your basic drugs. Yes, the correct option is your sodium bicarbonate. ठीक है, एस्पिरिन कौन सी ड्रग है? इट इज एन एसिडिक ड्रग, राइट? जो हमने कॉन्सेप्ट पढ़ते हैं फार्माकोकाइनेटिक्स में ही पढ़ते हैं. एसिडिक ड्रग के रिमूवल के लिए मेक द यूरिन मोर अल्कलाइन. सो सोडियम बाइकार्बोनेट will do that job and it will pull away aspirin out because acidic drug in basic medium they become ionized. Ionized drugs cannot be reabsorbed back into the body, so they will be removed. So acidic drugs के लिए यूरिन को हमें बेसिक करना है सोडियम बाइकार्बोनेट. ग्लूकागॉन will be in insulin. ठीक है. So N-acetylcysteine is for paracetamol. Do not confuse this. It's aspirin, 100 tablets. Aspirin overdose, very, very important. Again, aspirin हमेशा सारा कुछ एंटीडोट याद करना है, एस्पिरिन टॉक्सिटी याद करनी है, सब कुछ एस्पिरिन के बारे में आना चाहिए हमें. ठीक है. सो दिस इज फार्माकोकाइनेटिकली रिलेटेड क्वेश्चन. यस, बीटा ब्लॉकर्स यू कैन से. एंड 14 का हम देखते हैं. ड्रग यूज टू ट्रीट कीमोथेरेपी इंड्यूस्ड थ्रोम्बोसाइटोपेनिया. तो पिछले पेपर में आया था कीमोथेरेपी इंड्यूस्ड. आई थिंक देयर वाज a similar question also. Yeah, Oprelvecin. Very good. Chemotherapy induced thrombocytopenia is Oprelvecin. ठीक है, इंटरल्यूकिन, वेरी गुड। सो इसके स्पेलिंग में है ना, इंटरल्यूकिन 11 oprelvecin enhances the formation of platelets. What is filgrastim? Filgrastim is, filgrastim FMG पेपर में आया था उसका ऑप्शन. What is filgrastim? Granulocyte colony stimulating factor. And yes, it is used for neutropenia. I think last in the FMG it was asked for neutropenia, and this time it is thrombocytopenia. And darbepoetin, darbepoetin. Yes, you're right. It is GCSF. Darbepoetin, it is recombinant form of yes, erythropoietin. Yes. ठीक है, so the correct option here is oprelvecin. That is the recombinant erythropoietin. Very good. So this is oprelvecin is the correct option to this question. Next question. Yes, very good. Erythropoietin analog. A patient of bronchial asthma develops anxiety, restlessness, suggestive of hyperthyroidism. ठीक है. There was atrial fibrillation on ECG. BP was 180, 100 millimeter of mercury. What should be the management? तो पहले हम देखें क्या क्या पूछा है उसने. ब्रोंकियल आस्थमा का पेशेंट है. Anxiety, restlessness. If there's anything else which was there कुछ था कि there was a big nodule. If there was in the question, could you please write? BP was 160, 110. All right. BP was 160 by 110. Okay. ठीक है. So it was something on the grounds of hyperthyroid. Basically it's a thyroid storm. Hyperthyroidism है. And जो हमें patient had neck swelling. Yes, then that was neck swelling does the trick. So there was a neck swelling. ठीक है, neck swelling. एंजाइटी, रेस्टलेसनेस, हाइपरथायरॉइडिज्म. ठीक है, ये हमें 3 चीजें पता है. अब हमें जो फोकस करना है, किस पे करना है? फोकस हैज टू बी ऑन दिस थिंग विच इज द एट्रियल फिब्रिलेशन ऑन ईसीजी. सो पेशेंट को एट्रियल फिब्रिलेशन है. सो व्हाट वुड बी द करेक्ट आंसर? यस, सो Dr. Sana says 1, diltiazem. Black and White says 4, that is esmolol. Dr. Who else? Can you please option? P says 4, esmolol. Okay, if it is the answer to this only. Please explain this. Marked esmolol, all saying diltiazem. Yes. Actually, yes, it is. I will explain. Let me change this. This is diltiazem, not esmolol. क्यों नहीं दे सकता? चलो पहले हम बाकी करते हैं. क्यों नहीं हो सकता? ये क्यों नहीं हो सकता? प्रोप्रानोल क्यों नहीं हो सकता? आंसर वाई? अगर दो चीजें इसमें काम कर सकती हैं. योर CCBs कैन वर्क, योर बीटा ब्लॉकर्स कैन वर्क. ठीक है, अगर ये हम ब्रोंकियल आस्थमा को साइड, यस वेरी गुड, आस्थमा को साइड पे रखें, दोनों ऑप्शंस काम कर सकते थे, बीटा ब्लॉकर्स एज वेल एज योर कैल्शियम चैनल ब्लॉकर्स. बट अब प्रॉब्लम यह है कि पेशेंट को आस्थमा है. अगर पेशेंट को आस्थमा हो जाता है तो पेशेंट को बीटा ब्लॉकर्स हम नहीं दे सकते. ठीक है, सो non-selective, selectives, even if we have esmolol, कहते हैं selective है, but still there is a risk, because when you have a safer option available like diltiazem. ठीक है, yes, diltiazem is the answer. मैंने कर दिया tick. Yes, this is the answer. P, I've already said this is the answer. Diltiazem is the answer because calcium channel blocker, मैंने कहा दोनों में से choice करनी है, calcium channel blocker या beta blocker. पर जब एस्थमा आ ही गया, वाई विल यू रिस्क अ पेशेंट? इवन अगर एस्मोलॉल का ऑप्शन है, वो बीटा 1 सिलेक्टिव थोड़ा बहुत है, बट स्टिल देयर इज अ चांस ऑफ एक्साजर्बेटिंग द अस्थमा, बिकॉज नथिंग इन सिलेक्टिविटी डजंट मीन कि 100% सिलेक्टिव है वो बीटा 1 और बीटा 2 के लिए. कोई 100% सिलेक्टिविटी कभी नहीं होती ड्रग्स की. they always less risk definitely है, but they can always exacerbate. So we will stay away if we have a better option available like CCBs. So whether it is verapamil beta, it is CCB only, right? ठीक है. So you have, ये तो दे ही नहीं सकते सी, बाकी ये आप नहीं दोगे. The best choice here would be, if I have to go, it will be deltiazem. ठीक है, because we will not risk. तो ये तो दे ही नहीं सकते. इसमें मैंने बताया स्टिल 100% सिलेक्टिव नहीं है, देयर कैन बी अ रिस्क. और PTU एट्रियल फिब्रिलेशन में ऐसा कोई रोल नहीं है. ठीक है, सो द करेक्ट ऑप्शन हियर इज diltiazem. यस, गॉट इट. ऑल राइट, ऑल राइट. नाउ दिस वाज अनदर क्वेश्चन हियर. ड्रग थेरेपी फॉर हेपेटाइटिस बी. दिस इज द, अगर ये कंप्लीट है तो आप देख लो, हेपेटाइटिस बी विद हेपेटाइटिस ई एंटीजन पॉजिटिव एच एंटीजन. मे बी अब मुझे कंप्लीट इसमें आप करके देख सकते हो. यू जस्ट गिव मी वट एवर द करेक्ट ऑप्शन इज. अगर कुछ और एडिशन है इसमें नो, डोंट वरी. सो व्हाट इज द करेक्ट ऑप्शन हियर? Peg interferon alpha plus lamivudine for 52 weeks. Options एक मैं बता देना if there is any change in the option, because some was saying कि time दिया है, कहीं कहते हैं कि time नहीं दिया है, for how long. So if this is the actual answers, if they are the actual, because then it makes a lot of difference कि अगर किसी में time दिया है, किसी में नहीं दिया. So if there is anything option जो आपको लगता है कि नहीं सही है, आप उसको देख लेना. ठीक है. Okay, viral load. So there was a viral load to raised by 10. अच्छा, it was raised to 5. चलो, time was given 48 weeks. किस में दिया था 48 weeks? For both? For both it was 48 weeks? Okay. No time for Tino. Okay, no time for Tino. Peg interferon was 52 weeks. ठीक है. Okay, one option. So अब इसमें हम देखते हैं. See, the drug of choice for hepatitis B, usually we give a single therapy, and that is tenofovir. And tenofovir is usually given for 1 year. ठीक है. Peg interferons are maximum given for 48 weeks. 24 to 48 weeks. ठीक है. हम यूजुअली प्रेफर ही मोनोथेरेपी करते हैं. सो इसमें जो करेक्ट ऑप्शन बनेगा आपका, दैट शुड बी tenofovir. ठीक है. ऑल राइट, tenofovir. So tenofovir is the correct option here. राइट. कॉम्बिनेशन भी करेक्ट ऑप्शन नहीं, यूजुअली हम tenofovir ही प्रेफर करेंगे, सिंगल ऑप्शन. ठीक है. चलो, next, straightforward answer here also. Drug used for surgical prophylaxis in a patient posted for cardiac surgery is. Simple answer है इसमें. ठीक है. 3. Yes, it is cefazolin. It is the drug of choice for mostly all the surgical prophylaxis. Has a very long half-life, good tissue penetration. Yes, इसमें और कोई और option नहीं है. It is always cefazolin. ठीक है. Let's go to the next one. Yes. Now this one. A smoker was on nicotine therapy for smoking dependence and clonidine for hypertension. He stopped clonidine but continued nicotine, developed headache after 3 days. Mechanism of headache is due to. Okay. P says 1, A says 3, 3 here. 3, yes, it is rebound hypertension, classically seen after you abruptly stop clonidine. ठीक है. सो इसमें और कोई हम नहीं, classically seen when you abruptly stop clonidine, it is rebound hypertension. This is the correct option. Clonidine is a alpha 2 agonist, right? So it is as soon as you stop it, एकदम से patient को rebound hypertension होता है. This is the correct answer. ठीक है. Next one now. Patient having, again, a very, very straightforward question. having recurrent attack of gout, what of the following drug inhibits synthesis of uric acid? So basically इसमें हमें पूछा ही यही है, synthesis of uric acid कौन inhibit करता है? Very good मशरूफ, it is allopurinol. दो drugs हैं, allopurinol, febuxostat, दोनों में से कोई भी आ जाए, they are uric acid synthesis inhibitor. Colchicine used in only acute attack, ठीक है, it's an anti-inflammatory. And probenecid it is used for increasing the secretion, so uric acid secretion increase karta hai. Diclofenac again anti-inflammatory. So the option is allopurinol. Absolutely correct, all of you. Good. Let's go to the other one now. Here, a 3-week-old child presents with paroxysmal cough, fever, TLC more than 50,000 with, I think, absolute lymphocytosis. What will be the management here? Azithromycin. Very good. Azithromycin. Yes, azithromycin is the drug of choice. So, agar less than 1 month ka age hai, we prefer azithromycin. Greater than 1 month, we can use drugs like clarithromycin. And why we cannot use clarithromycin and drugs when the child is less than 1 month? Because of the problem of pyloric stenosis. ठीक है? So ये भी आप याद रख लो, pyloric stenosis, in case they ask. So that is the reason azithromycin is the correct. So what is the diagnosis? It is, you know that, pertussis or whooping cough. ठीक है? Let's go to the next one. I hope there's no doubt in this one. ठीक है? Simple. इसमें आंसर यही लिखना है आपने. Old lady with hypertension, BP 160, 110. Now BP plays a very major role in this question. So if there is anything, if the BP was something else and not this, just let me know, because BP answer change कर देता है इस question का. Develop subarachnoid hemorrhage. What can be the management? CT angiography. You can look for the aneurysm, nimodipine and TPA. और ये भी देख लेना कि ऑप्शन सारे ठीक हैं, यही ऑप्शंस थे, कोई और ऑप्शन तो नहीं था, बिकॉज इट्स करेक्ट. ऑल राइट. तो BP 160 by 110 ही था. ऑल राइट, ऑल राइट. चलो जी, टेल मी द करेक्ट आंसर टू दिस 333. ओके, नाउ देयर इज अ लिटिल कॉन्ट्रोवर्सी हियर. नाउ क्या होता है, एज अ फार्माकोलॉजिस्ट अगर मैं देखूँ तो मुझे भी लगेगा कि निमोडिपिन शुड बी द करेक्ट आंसर. 160 था, ठीक है. बट प्रॉब्लम है कि एक्चुअली इसका आंसर should be this, because I think it was what can be the next step in management. Was this the question, next step in management? Though we still, I need to just be sure, but I think जो nimodipine देते हैं when the BP is quite high, more than 220, ठीक है, more than 220, तब हम nimodipine देते हैं. हाँ, the next step actually, हाँ, nimodipine BP, but ये है कि 220 के अगर BP तब तक चला जाए, then we have to give nimodipine. अगर 160, 110 है, then we do not have, immediate next step नहीं होगा nimodipine तब होएगा जब BP is very very high like this. But एक बार मैं फिर से confirm करूँगी, but this is actually what I've found out. ठीक है, CT angio should be the next step. थोड़ा controversial because पहले everybody was saying it is nimodipine, but the problem is nimodipine में BP, that's why I was asking BP 160 by 110 ही था, because BP high या low will change the management. ठीक है. Okay, question now. The pregnant female develops PPH with a history of asthma. ठीक है. What drug will be contraindicated? So दो चीजें हैं, PPH and asthma. 1, carboprost. Mashroof Ali says carboprost. Yes, very good, very good. Yes, this is the correct answer. Carboprost. Yes, so all of you, Sana, no, it is not misoprostol. Carboprost, because carboprost जो है ये है PG alpha 2. ठीक है, ये तो ये जो होते हैं जो PG alpha 2 agonist, ये ब्रोंकोकंस्ट्रिक्टर होते हैं, पोटेंट ब्रोंकोकंस्ट्रिक्टर्स. सो देयरफॉर यू कैन नॉट यूज देम बिकॉज एस्थमा साथ में दिया हुआ है. यू कैन नॉट यूज देम. ठीक है. So dinoprostone and like drugs, they can be used, but carboprost should not be used. Correct? Okay. Now this is the last question which I had, and isme again I don't have the fourth option. Isme I just have three options. If this was, and let's see if this was the correct option, and there was a picture slide भी दिया हुआ था इसमें मेरे ख्याल से शायद. ठीक है. If just correct me if I'm wrong. Slide दिया था. A young patient with multiple sexual partners develops vaginal discharge. Treatment is penicillin. No. This actually is Neisseria gonorrhea का case. ठीक है. And because there was a slide, I couldn't find. There was a slide given, and उसका drug of choice is your ceftriaxone. Ceftriaxone, yes, it is the correct option. Fourth, Mitu, are you telling me the choice penicillin? Gonococcal wala pick. Yeah. There was a pick also. I think there was a pick. Fourth option was penicillin. All right. Thank you. So this will complete the question. Penicillin. Now these were, I think, the questions which I could actually gather. Any other question? जो हमने नहीं इसमें cover किया? Yeah. I think. Yes, Ankur. I think that's how you could make out it is Neisseria gonorrhea. It was actually a question maybe... interrelated question था ना, integrated question था, that's why. Any other question which you think जो pharma से आया and we missed out? कि maximum cover हो गया? P, I think we'll do that soon. Don't worry. ठीक है. इन केस आपको लगे देर इज सम जो आपको याद आएगी, इफ यू नॉट रिमेंबरिंग, और कोई क्वेश्चन रह गया एंड यू वांट दैट वी कैन इंक्लूड दैट एंड शेयर इट विद यू, आप कमेंट सेक्शन में आप उसको लिख दो, रिपीट कर दीजिए. क्या बेटा, क्या रिपीट करूं? सारा, ऑल द क्वेश्चंस यू वांट मी टू जस्ट गो थ्रू वंस अगेन? All right, let's just do a quick recap of what we've done, the questions. ठीक है. So what we discussed, the first question, old wife or truck driver. Write it complete because you would need the, इसमें options वगैरह जो भी होंगे आप वो मुझे लिख देना. ठीक है. Okay. ठीक है. So first question हमने किया था, OP poisoning था, pharmaco, and he was treated with atropine and palidoxime, और उसके बाद उसको हो गया hypothermia. So what was the reason for the present complaint? So hypothermia का reason is side effects. It is a side effect of atropine. You know, it causes decrease in the sweating leading to hypothermia. So that was the, ठीक है, that was the cause of hypothermia. तो ये ADRs होते हैं atropine के. So you know the ADRs, dry mouth and mydriasis causing photophobia, retention, constipation, and decrease in the sweating. Second question भी इसी पे था, surprisingly, another one on atropine, कि photophobia अभी हमने किया because of mydriasis, not able to pass urine, dry hot skin. तो अगर child ने एक seed लिया, so it is most probably dhatura poisoning, and the treatment of choice for dhatura poisoning is physostigmine. This is for this. ठीक है. So this is the management. The third one is, which of the following drug inhibits both neprilysin and ACE? ठीक है. और conversion of ACE1 to ACE2, दोनों drugs जो करती है, the correct option is your omapatrilat. Omapatrilat, the problem only is it is not marketed because of the main issue of causing angioedema. ठीक है. angioedema करते हैं. बाकी sacubitril जो है neprilysin inhibitor है, neseritide BNP analog है. So the correct option is omapatrilat. The next one was, which of the following drugs shows the side effects of pulmonary fibrosis, hypothyroidism? And the correct option here is amiodarone. ठीक है. Link will be shared to you, बेटा मिट्टू. So ये एक mnemonic याद कर लो, drugs causing pulmonary fibrosis, BBC ban me. ठीक है. BBC ban me. सो इसमें सारी ड्रग्स आती हैं, ब्लियोमाइसिन, बुसल्फान, साइक्लोफॉसमाइड, ब्रोमोक्रिप्टीन, एम्योड्रोन, नाइट्रोफ्यूरेंटोइन, मीथोट्रेक्सेट, ऑल ऑफ देम कॉज, ठीक है। ओके, वो किट्स वाला क्वेश्चन है, तो दैट इज नॉट फार्माकोलॉजी डोमेन, ठीक है। सो दैट इज अ किट क्वेश्चन, तो ड्रग्स हैं साथ में। ओके, सो द नेक्स्ट वर्क क्वेश्चन इसके बाद आया था, डिजॉक्सिन का प्लाज्मा कॉन्सेंट्रेशन वाज गिवन, द टॉक्सिक कॉन्सेंट्रेशन जो थी उसकी 4 नैनोग्राम्स पर ml, और the doctor wants it to come down to 1 nanogram per ml, and the half life was given as 40 hours. So how much time will it take for the digoxin level to come down from 4 to 1? तो आपको सिंपल इसको, एक हाफ लाइफ है 40, 2 हाफ लाइफ कितनी होगी 80. So simple calculation 80 hours. Sixth question regarding the ARBs, which is a true statement, ठीक है। So इसमें जो true statement, losartan has thromboxane A2 antagonist action and attenuates platelet aggregation, ठीक है। ये इसमें फर्स्ट ऑप्शन था। बाकी था telmisartan, it's affected in renal insufficiency, not in hepatic. Irbesartan clearance is affected both hepatic and renal, and candesartan clearance is affected in hepatic insufficiency, not in renal. So इसमें clear cut answer है, which is the standout line इसमें है first, so that is the clear cut option. और ये आप एक चीज याद रख लेना कि candesartan is the drug which is unsafe in both liver and kidney disease. बाकी irbesartan, telmi, losartan ये सारी की सारी unsafe हैं in the liver disease. Then this was the ECG changes, tall T waves, ठीक है जी, tall T waves ECG changes. So this is a classical finding in hyperkalemia, and hyperkalemia is a feature of this drug spironolactone. So I told you that, remember, सारा RAS, जितने भी RAS की drugs हैं, they cause hyperkalemia as their side effect. So drug used in dialysis disequilibrium syndrome is mannitol. Mannitol is used in this, and remember the uses of mannitol कितने होते हैं? It is a drug of choice. IV mannitol for acute congestive glaucoma, cerebral edema, dialysis disequilibrium में इसको use करते हैं, and cisplatin induced nephrotoxicity. So these are the uses of mannitol. CAD is the mnemonic to remember this, and it should be not used or contraindicated in pulmonary edema, cerebral hemorrhage, acute renal failure. ठीक है। Simple question is mechanism of action of tissue plasminogen activator. Is very simple, inhibits the fibrinolysis. Then the question was, an asthmatic patient using nebulizer developed oral thrush on buccal mucosa in tongue. So which antifungal will you use? You will use here clotrimazole. ठीक है, बिकॉज टेबमेफिन और जो ग्रीजोफेलोइन है डर्मेटोफाइट्स के लिए यूज करते हैं, 5-flucytosine along with amphotericin B for cryptococcal meningitis. Then this question was like a resistant case, ठीक है, जिसमें हेलोपेरिडोल भी काम नहीं कर रहा, थायरोडिजिन भी काम नहीं कर रहा. So we add a new drug. So we need to add something from the atypical antipsychotics. And what happened to the patient? Excessive salivation or cialorrhea इसको कह सकते हैं, hyperlipidemia, weight gain, hyperglycemia, sedation. So what is this new drug? So this new drug, because the cialorrhea is very outstanding here, it is caused by clozapine. Clozapine is the clear-cut answer because of this excessive salivation feature. And it causes metabolic syndrome, and it causes sedation, of course. Okay. The next one was alcoholic patient develops nystagmus, confusion, ataxia. Which vitamin deficiency? So it's the vernix encephalopathy, thiamine deficiency, vitamin B1. Then 100 tablets of aspirin were consumed. So what should be the treatment? So it is an acidic drug. Acidic drug needs to be removed by a basic medium. So we use a urinary alkalizer like soda bicarb, sodium bicarbonate, and that will remove the acidic drug from the body. Then drug used to treat chemotherapy-induced thrombocytopenia, we have oprelvacin. ठीक है? So that is the correct option out of all of them. Patient of bronchial asthma. Next one here is patient of bronchial asthma with neck swelling, develops anxiety, restlessness, suggestive of hyperthyroidism. So it is suggested the patient is going into, and because there is atrial fibrillation, thyroid storm mein, there is a strong chance of patient going into atrial fibrillation, and the BP was 160, 110. So what should be the management here? So remember, because of asthma, we will rule out any beta blocker. ठीक है, चाहे वो selective है नहीं है, but अगर हमारे पास CCB available है, then we will always go with the calcium channel blocker. The next is drug therapy for hepatitis B. It is the drug of choice is tenofovir. For 1 year we use this drug tenofovir. Interferons are never used for more than 48 weeks. Okay? They have a lot of side effects later, and so never use more than 48 weeks. So the drug of choice is tenofovir here. And then the next one is for surgical prophylaxis. So always remember cefazolin left and right. Surgical prophylaxis के लिए हमेशा use होता है, one of the preferred drugs. Then nicotine, clonidine. ठीक है, clonidine जब भी rebound hypertension का नाम आता है, clonidine is one notorious drug to cause rebound hypertension. So remember that, rebound hypertension with clonidine. Then in this question it will ask which is the drug which inhibits the synthesis of uric acid. ठीक है, so आपके पास options ही है, allopurinol. अगर दूसरा होता febuxostat, you would have marked that. The rest of the drugs don't fit the description. ठीक है, propanopicid is it excretes the uric acid, and diclofenac, colchicine, दोनों anti-inflammatory, right? Then pertussis का case था, a 3-week-old child. So the age of the child here makes the differentiation. Which drug should you give? Had the age been more than 1 month, then you could have given any. But because it's less than 1 month, 3 weeks hai, so we do not give clarithromycin here. We give azithromycin. ठीक है? So this one again, it's a very little tricky and controversial question, but as I said that nimodipine यहाँ पे use तभी करेंगे when there is a very high BP. ठीक है? So otherwise the next best step would be to do a CT angio. A pregnant female PPH, history of asthma, कौन सी drug नहीं देंगे, which is contraindicated here is carboprost. So prostaglandin F2 alpha are totally contraindicated because they cause bronchoconstriction. Question of, you're saying for 20th? Okay. Cotrimoxazole, all right, cotrimoxazole, okay. So these were the questions actually, and this last one was multiple sexual partners develops vaginal discharge. Treatment is ceftriaxone because it was a case of gonorrhea. ठीक है? So these were the questions which I could now find out. Any other question if you see कि अगर कुछ आपको याद आता है बाद में which has not been covered, just drop in the comment section and I can add it here and then post it to your group. All right. So whatever the answers or whatever your after this session आपको कुछ भी लगा है ये गलत है वो गलत, doesn't matter, just do not think ना जो हो गया वो हो गया, if we cannot change it, it's just for further learning. ठीक है, learning के लिए है, and so hope for the best, wish you all the best for future. So let's stop the session now. Okay, thank you so much, thank you for joining and hope you could make out the answers. ठीक है? All right. Thank you so much. Have a great evening.